And thanks for staying with us. The Ghana AIDS Commission says there are more than 100,000 cases of HIV in Ghana. And these people carrying the virus are unaware and continue to spread the disease. This is the latest we're receiving from the Director General of the Ghana AIDS Commission, who says that the Commission has mounted an aggressive search for these persons to bring them under treatment. He made the revelation in an interview with Joy News head of Health Desk, Fred Smith. Shortly, we'll bring that after announcing the country's latest HIV figures at a news conference in Accra. We'll bring that to you. But first, though, let's look at the figures as we have them. But before we do all of that, the Director General has been speaking to Fred Smith. Let's listen in.
First of all, looking at the HIV population, which is roughly about 355,000, it clearly shows that the sex distribution presents a major concern because the women are disproportionately affected. It is natural that that should be the case. But what is worrying about that is the fact that women are not receiving the needed support they need from men to protect themselves. Why I'm saying that is because 80% of HIV transmission in this country occurs through sexual contact. And therefore, women and men having sex would require that if we want to reduce new infections, then obviously there should be protection. And protection means wearing a condom correctly and consistently anytime one has sex, especially if the sexual activity occurs outside a stable relationship like marriage or something like that. And so that is a major issue for us. Women's vulnerability should be reduced in collaboration with men if we should achieve the targets we've set for ourselves in achieving zero new infections in the country.
But if you look at the story behind the numbers as have been presented to us today, what do you think women are doing wrong specifically from your observation of what happens in the country to have such a disturbing situation, nearly double the number of men with HIV infections in Ghana?
Well, now we know that women are more liberated to the extent that they say what men can do, women can do better. And so in the traditional setting, women were not allowed to have multiple partners. But today it's a common place to see or talk about, young women and, of course, women in general having multiple sexual partners. And they have no inhibitions doing that. They have no inhibitions talking about that. And so if you watch some of the street, interviews done by people which are usually featured on social media, you see that one woman can have multiple sex partners, so is young men. Young men. And so we are having women not only having multiple sexual partners, which is a major risk in the first place if they are not protecting themselves. But we have more and more young women going into sex work. And some who do not recognize that what they are doing is sex work is actually, they are actually doing exactly what sex workers do.
Explain that.
What I mean is that some of them may not recognize they are doing sex work, but in actual fact, they are doing sex work. Why?
In what way?
Sex work is about exchanging, sex for money or for gifts or any other thing. Okay. And so here is the case where we have many women seeing their bodies as source of income. And if you use your body as source of income, then it means you will have to make the body available to multiple men in order to raise enough income. And that is where the challenge is.
Is that the situation in Ghana here? Do you see a lot of them doing this?
Yes, yes. The first time we did sex worker population size estimate, that was 2011. The population then was around, I think, oh, forgive me, it was, I think, 50,000. Now it's, the last time we did it, it was almost 70,000. That is 4 years after. And now when you go out there, you see young people, even some at the tender age of 10, on the street soliciting. Now, many of them don't solicit on the streets. They do it what they call on the internet. And so you have hookup where a young lady will go, of course, young men are also doing the same, will go to a client, at an agreed place. And we have some who are also doing it, they operate, from a home-based kind of setting. And so it's going on. We have high-class sex workers who live in, luxury apartments, and their clients are, people of substance in society who actually patronize their services. So we have all these things happening in Ghana.
This is worrying, and I noticed that you have interventions to deal with this, but can you brief us on any advice for women directly so that we're able to reduce the spread amongst them, and once that happens, we know we will be able to reduce that amongst men?
Yes, so first of all, having multiple sexual partners is a high risk. And if you want to reduce the risk, you first reduce the number of sex partners. And if that is too difficult for you, then you have to protect yourself at all times, because you do not know what your client is capable of giving you. Number two is that you have to test to know your HIV status, because for you to effectively protect yourself against HIV, you should know whether you have it or not. Because if you have it and you think you are protecting yourself, it amounts to nothing. And so first know your HIV status. Do well to know the HIV status of your partner. Now we have self-test kits, which are free. At the moment, they are free. So you can have as many as you want, and then encourage your partners to test if you are a sex worker. But that is not the only thing you have to do. You also have to be mindful of the fact that you are exposing yourself to not only HIV risk, a risk of contracting HIV, but other sexually transmitted infections. You may not even be prepared to get pregnant or make somebody pregnant if you are a man. And so you have to take all these things into account and protect yourself.
Realistically, you know the economy is getting tougher by the day, and people have to find ways and means to survive. Do you think this message, yes, as good as it may be, do you think people can easily accept and practice them as you've preached?
Right. Yes, the economy is tight. life is difficult for majority of Ghanaians, but there is consequence for every choice we make. And so you must be mindful that whatever choice you are making today has a consequence. And the consequence is that if you are engaging in sex and you don't know your status or the status of your partner, you should understand that you are actually engaging in a risky activity, or you are putting yourself at risk of not only HIV but other sexually transmitted infections. That's number one. Number two is that selling your body is not the only way that you can make livelihood. There are a lot of things you can do to keep yourself going. And I think one should consider such options as well, and not look at only the easiest way out of the situation, because there is nothing easy anywhere. When you get infected with HIV, it's going to change your life for the rest of your life. Why? Because even when you are on treatment, you will not be cured by the treatment, which means you will live with it for the rest of your life. Is that better than living without HIV? It's a question everybody has to, answer for him or herself.
But we're seeing a lot of these cases in the Greater Accra region, Ashanti region. What's accounting for the high numbers in the big cities?
Well, the literature clearly shows that urbanization has got a lot to do with HIV infections, and not only HIV, other epidemics, we see the same trend. And in the urban settings, people have to do a number of things, especially migrants. You have on the streets of Accra many young people who have traveled from far places to come and make a living here. They don't find the jobs, and so they end up on the streets. And surviving on the street is difficult. So they need to get involved in street-based commercial activities. That doesn't earn them much, and they have to supplement their income. And so they end up getting involved in sex work or having sex with multiple partners. And sometimes too, they fall into the hands of pimps who use them as sex workers, and make money out of them. And so the urban environment creates a lot of challenges for people who may end up getting HIV, because accommodation is, inadequate, and so people have to sleep rough, and sleeping rough means being exposed to all kinds of, challenges, and that is what urbanization, impact, how urbanization impacts on the health of the people, and in this case, HIV infections. But the simple explanation is that Greater Accra has the largest population, is the region with the largest population in Ghana, followed by Ashanti. And so naturally you expect that Greater Accra should have more HIV population than any other region in the country. And that is what we are seeing from this data.
So as bad as the situation looks, and you've mentioned that poverty has a lot to do with the spread of the virus, what do you see the situation for 2023, as you've already started some projections on that?
Yes. 2023, we expect new infections to reduce, as we've seen between 2021 and 2022. And we are desirous to see a much reduction, much more reduction than we've seen in the last year, because our target is to reduce new infections by 17%. And so anything less than that will mean that we are not doing well. And that is why every Ghanaian has to work with the Commission in ensuring that they protect themselves so we can reduce new infections.
And we have a target, 2030, to eliminate HIV AIDS from Ghana. How are we progressing on that?
Well, for us to end AIDS in Ghana, we have to diagnose 95% of people living with HIV in the country and put 95% of those diagnosed on treatment, antiretroviral treatment, and 95% of those on treatment must become virally suppressed. Currently, HIV diagnosis or case detection is at 71, almost 72%. And then those on treatment is 71.8% for know your status. That is the first 95. The second 95 is 87.4%. And the third 95 is 68.1%. That is where it stands. And what that means is that more than 28% of people living with HIV still do not know their HIV status because they have not tested. And
more than 28%?
Yes.
That represents what number?
That represents about 100,000 people.
100,000 people?
Yes.
You mean all of these are out there, they don't know they have HIV and maybe spreading?
Exactly. That is what is happening. And of course, they are spreading it unknowingly. And that is not the best. And in fact, if someone, it's important for everyone to know their HIV status. And knowing it early, is very important, even for treatment success. If you wait till you get AIDS before you go to hospital, it will take a much longer time for you to recover in terms of boosting your immune system, for it to, regenerate and support your body. It takes longer time. And so it is important that you get tested to know your HIV status when you are strong and well. When you see no symptoms, HIV infected related symptoms, that is the best time. And in fact, at the time when you don't feel sick and you have no signs, that is when you can transmit the virus even more. Why? Because being in the acute stage of infection means that you are highly infectious and you transmit the virus, more than somebody who is not in the acute state. And so it is important that we test to know our status as early as possible and go on to treatment so that you can, prolong your life and have a healthy life and productive life.
And briefly, are you on the search for all of these 100,000 people?
Yes, we are. That is why we launched the self-test campaign 2 weeks ago, because there are people who are underserved when it comes to HIV services. Some are hard to reach, and they may not have the opportunity to get any of the services. And so bringing testing to their doorsteps, and the self-test kits are being distributed in the communities. So bringing it to their doorsteps will enable those who fear to know their status to at least start the process by testing to see whether they are reactive or non-reactive. And if they are reactive, then they can go to health facility and have further diagnosis and management. And it is very critical that everyone gets to know his or her HIV status.
Finally, are we going to be able to eliminate HIV AIDS by 2030 per the data you have?
It's subject to a number of factors if we could be successful in this target. Number one is the cooperation of Ghanaians, taking HIV seriously and eliminating the current level of high complacency and taking HIV as a serious matter and protecting themselves. That's number one. Number two is that we have the strategies to achieve it. We have the policies, we have the programs and the tools to achieve. We have the human capacity to achieve the targets. However, we don't have the resources to provide the services that will enable us achieve the targets. And that is where one of the major problems. And so the Commission, within its mandate, is initiating domestic resource mobilization activities, campaign to give the opportunity to all Ghanaians to contribute to the AIDS Fund. We know that there are well-to-do Ghanaians who are affected by HIV, whether they live with it themselves or they have family members who are affected or friends who are affected. And they will be kind enough to contribute or donate to the fund so that we can save lives and support children who, for no fault of theirs, have become victims in terms of becoming AIDS orphans because AIDS has taken their mothers and fathers away and they do not have anyone to look after them. And we should be able to also prevent new infections. And all these call for huge investment. And so the donation that we are asking for would help us do this. And it's opportunity we are giving to all Ghanaians to contribute. And so you can dial the USSD code *9898# and donate to the fund. Follow the prompts and donate to the fund. We have bank account, fund account numbers at Bank of Ghana, and that can also be used in paying directly into the account. And very soon we are going to share all the materials on both traditional and social media for more and more Ghanaians to know about it and donate to the fund. And without the contribution of Ghanaians, we will fail as a country. We won't be able to achieve it because now our donors who are giving us money for the AIDS response, they insist that we should have the fund, 60% of the funds needed for HIV response domestically. And they are paying 40%, but currently their contribution is less than 40%. For the next 3 years, their contribution every year is going to be 33%. So we should raise the 67% domestically. And that means government, corporate Ghana, individuals, philanthropists, everybody has to be involved. And no amount is too small. Even 1 cedi, even 10 pesos. If we have 1,000 people donating 10 pesos, that will give us some money. So no amount is too small. Please feel free to donate to the AIDS Fund for us to save lives and prevent new infections in the country and support those who are affected by HIV, for example, AIDS orphans. Thank you.
Many thanks, and a pleasure speaking to you.
Yeah, thank you for having me, and it's always a pleasure working with you.
Thank you.
Yes.